So let's move into a little bit more fun, and that's actually working on some emotional factors in order to be able to see if there's kind of a trauma or life experience or something that is impeding then the body's ability to heal itself. And I've asked Jan to be my subject.
My amethyst.
And as I said, about 50% of people survived, so since the first one survived,
I guess it's safe.
So, yes, do you mind telling a little bit about yourself?
Okay, my name is Jan Johnson, and I started seeing Dr. Karlfeldt about, it's not quite 2 years ago, because I felt like I just didn't feel good. My doctor said there's really nothing wrong with me, it's all in my head. I'd had problems with my liver and my gallbladder, and they did scans and things and said that my gallbladder emptied slowly, but all my blood work was really virtually normal. I was a little on the high side for stuff, but normal. And I weighed about 45 pounds more at that time, but I didn't feel really sick. But Dr. Karlfeldt had come to my office and did some foot reflexology, and it felt really good, and then he did a little bit of muscle testing. And so I was real tempted and went into his office. Well, in the process we found out, we started detoxing things, and well, I thought I had fibromyalgia. My skin itched and was tingly all the time, and my teeth hurt all the time. But they have for years, like over 23 years. And the doctor just said, you know, that's just the way you are. It's just the way you're built. So anyhow, get into testing and start trying things. And first we found out that I had formaldehyde and mercury in my system. I worked in an office that had been remodeled. And for some reason my body was sensitive to this. And so I reacted, so we did detoxing on those things and made me really sick, and I had panic attacks. He helped me through those with different herbs and with different supplements. And in the process I started losing weight and started feeling better. And lost over the 2 years the weight. But last June, the problems with the liver started coming back. The pain in my liver went away. The sensitivity in my skin went away. My teeth stopped hurting. I could go to the dentist. They could work on me. It was like, this is like a miracle. And then I started getting worse again. I'd be testing and things just were not, the liver started bothering me. And at the same time, I found a small lump in my breast. And at the same time, he also said that I had Bartonella bacteria that showed up in the testing. Once we got rid of all this other stuff, the Bartonella showed up. And my mammogram, and they did checks and everything. They said, well, it's just a benign fibroadenoma. Don't worry about it, go on with your life. So I'd been under a lot of stress. All this 10 years is a long process. And come to find out in December, this is not the benign fibroadenoma. It's actually invasive ductal carcinoma, for which I'm having surgery next week. But in the meantime, we're detoxing all these other things and strengthening my body. So that's my story.
So what I'm curious about then is that, as I was explaining, when you have emotional factors, or there's a trauma or some life event that upsets your energy in a way, it will then attract certain. You can put yourself in a place where you're then attracting certain pathogens, or you're more prone to load up on a certain metal or a certain chemical, etc. So that there can be then an emotional factor that will put you in a position where you're more likely to get a certain health issue. So what I'm curious about, and I haven't done it yet, I don't believe, to see if Bartonella, which is one of the bugs that we're dealing with, if it has an emotional factor to it, and because you then have the emotional factor that makes it easier for that bug, for that virus, or for that chemical or heavy metal to exist within that system. So So I have then little slides here, and this is a Bartonella slide. And even though it's just a slide and not a substance, it still emits a certain frequency. So it still emits information about what this is. And these little things right here, they are what's called signal enhancers. They're done in a very specific way, so whatever I put on them, the signal on it will be enhanced and be easier to be picked up by her system. So it's just one of these little toys that I have in my office. So first, let me borrow your arm and just match my pressure. Okay. And then we're going to put this one on here and see if she is in an open regulation, and she is. So then we want to see, I'm just going to put this here so it's more visible. So put that one on, and we see, yeah, it put her then in a blocked state. So meaning that the presence of this bug then creates a blocked state in her system. Her autonomic nervous system is not able to regulate. So, and that can also mean upregulation of immune system, downregulation of immune system. It can mean pretty much anything that needs to be regulated. So without it, open; with it, blocked. So there is a way then to see whether there is an emotional factor that's connected then to this bug. And a very simple way of doing that is actually through eye movement. Eye movement opens up certain areas of the brain where we store memories, emotions, etc. So let me borrow your arm. So you see it's blocked here, and then I want to see if eye movements then will actually change this testing if the arm goes into then open regulation. So if you move your eyes all the way up to, just look up, it's fine, then look down. So here, it changed, and then you just have it in a neutral position. Now it's blocked again, and you look down. So there's some part of the brain that the body then is accessing, or that she's accessing, that then relates to this bug. There's some emotional factor. So then we want to look a little bit deeper, so we can then, with eye movement, we can then open up that pathway. And also you can use color. So I have then different colored glasses, and you can then see if there's a color that also opens up then these memories. Every memory is color coded, and also as you are processing events throughout the day while you're sleeping, your eyes move during that REM sleep. Your eyes move continually, and it stores then all these memories in different areas of the brain. So by then opening up eye movements and then also using colors, you allow things that were stored in the subconscious to become more available, to enter into the more of a conscious state, so that the body can then start to deal with that memory. So we know then that the eye movement changed the test, and we want to see if there's a color of the glass, a color that will change the test also. So let me borrow. So I'm just putting these blocks then on certain colors and enhancing the signal from those colors and see if any one of those change the test. And one of them did. So then I want to isolate which one it is. None of those do. Then I'm just moving it then to the next one. That one doesn't. This one does. So this color then opens up then the memory that relates to that bug. So by having the bug still there, that becomes like a focal point. So everything that we're doing is focused and relates in relationship to that bug. We could do the same with a heavy metal, we can do the same with a chemical, and see if there's an emotional component that relates to it. So see with it, without it. With it. So then you can do a treatment with that. You can relax your arm for a second. And the way that goes is just put these What's that?
There's a purple one. It's a different color.
Yeah. Just put these on and just open your eyes and just follow my hand. So this way you just open up the pathways of those memories, using then the color, eye movement, just allows something that has then been stored in a deeper area of the brain that's not as available to start to become more available so that it can be dealt with then in relationship to that bug, so you don't have that emotional factor as a reason for that bug to keep coming in. I mean, we can go after the bug again and again, but if you don't remove the real cause or the emotional factor that's underlying it, it will be quite hard to get rid of it, because the body will keep inviting it. And then just by moving the hand back and forth, you assess actually, or you access both the parasympathetic and the sympathetic nervous system at the same time, because of the relaxation then of the eye and the contraction of the eye. So let me borrow your arm again. And see, now her body, even with the presence of that bug, she's then in a what's called an open regulation. So it's doing perfectly fine. But then we want to check it then on a weaker level, which is actually just the sympathetic side. And then I remove that pole filter, so a polarized filter. And see, she's weak with it on, so it still has a negative effect. If I remove it, she's strong. I put it back, and she's weak. So then I can check, there are certain emotions that are connected to different organs. So you can have like an access point through an organ to see what type of emotions that she might be dealing with. For instance, fear frequently shows up in the kidneys. Anger frequently shows up in the liver. So certain emotions will generate a certain neurotransmitter picture that will then affect certain organs. And by then having the organ as a kind of an access point, you know what type of quality of emotions you're dealing with. So, so what I can do then is, by having this one on, it still has that as a focus point, and then I want to see if any organ change then the test. So I'm just putting pressure then on the different organs. And here we have the gallbladder, which is not a big surprise. So we know then that the gallbladder is connected then to the emotions that relate to the gallbladder is then connected to what's going on then with the Bartonella. So relax the arm for a little bit. So there, as I said, there are certain emotions and that are connected with each organ. So I can just pull up a list of the ones that they found are connected. So let me borrow this arm again. So you see it's weak, but we've already assessed that it's a gallbladder, so we just read through. Now she's strong. Resentment, victimhood, incapable to decide, martyr, blaming. So we struck a nerve there somewhere, blaming. So we know that it's something to do with blame. And we can then check and see where did this originate. So all I'm testing then if is something that creates a stress in the body by just saying the time period. Like for instance, conception to birth. Yeah, conception to birth. And we do birth to 10 years old. No? 10 to 20. 20 to now. So conception to birth. So know that there is something that happened then from conception to birth in relationship to blaming. Yeah, so you're off the hook. Exactly. I can feel it.
Our marriage is safe.
Yeah, exactly. Valentine's Day is looking better. And we can also then check and see if it is just from you, or if it's coming from the mother side, father side, or we can direct it. So do mother side, father side. So we know something is going on the father, something that was taking place at that time. Was it first trimester, second trimester? So the fourth month, fifth month, fourth month. So we know then that there is something that was going on in the fourth month in relationship to the father, has to do with blaming. And I don't know what it is, but we can then start then a conversation and then see what it is that's going on. And by doing what we've done with the eyes, with the color, it allows things, as I said, things that are more on the subconscious level to become more conscious. So then when we have a conversation, things that are coming out will then be more in relationship to that. So these are then just anchor points that we are using to be able to bring things up, things that were stored, so that the body can then start to process it. So thank you very much.
So why is it father and mother?
I don't know, it's your fault. These things, when you bring these things up, that they become anchor points, so they become like pathways. They are not, the information you're getting are not always written in stones. They are like pathways that you open up, and whatever comes up underneath that is what you need to listen to, and that is what's needed to come out. So after you've done what I just did, you can then start a conversation and allow things then to process consciously, and then also have the person do a writing exercise and do that for 3 days after, and then just for 20 minutes straight, just make sure that they're continually writing. Do not stop moving the pen, even if it just, doing doodles. You just need to allow that pen to move, and that allows some things that were not available consciously to then come out into physical space, so that the body can then start to deal with it.